In this episode of Ask Me Anything, I got a great question from a massage therapist on LinkedIn named Lisa, who asks me what my views are on the treatment methods using lymphatic drainage. What's up, everybody? Dr. Matt Maggio here, and for those of you that don't know me, I am the creator of the Peak Method and founder of the Soft Tissue Revolution, where we teach self-employed massage therapists a new treatment system that focuses on working smarter, not harder, allowing them to cut their treatment times by 50% so they can stay healthy and help more people get out of pain. Back at it for Ask Me Anything. Let me read the full question. It says, I have been following your content for over a year now and noticed you have never given your views on treatment of injuries using lymphatic drainage. I was looking at taking a course that is coming close to me, and I wanted to see if you thought it would be beneficial to add to my treatments. Thank you so much for that question. I always appreciate when you guys send questions in. I love answering them. I'll give a little trigger warning here. Anyone that is a lymphatic drainage guru that wants to send me some hate mail, please watch the full video before you comment on it or send me hate mail. I'm just going to give my personal opinion and my personal recommendation of what I think. So let's break it down first to what is treatment in the most basic sense. Treatment is a reduction or a removal of a pathology. In musculoskeletal injuries, there are 7 potential problems that can cause injuries, and only 7. We can argue about this, but there really is only 7. There is a bone problem, there is a cartilage problem, there is a disc problem, there is a ligament problem, there is a nerve problem, there is a soft tissue problem, and there is a tendon problem. There is only 7 of those potentially things that can be broken down and removed through treatment. So another criteria for treatment, it must be safe, it must be effective, and it must be durable. A big question that so many practitioners miss and so many training courses out there miss is answering the question of why. Why is the injury presenting in the first place? We just want to jump right into treatment. I always say, imagine if your car had a problem and you took it to the mechanic and the mechanic didn't run any diagnostic tests and just started hammering away on the car. You'd be like, what the hell are you doing? Run some tests. You do the same thing as practitioners. A big question I always ask in my history, I ask a very thorough and detailed history, at least 12 questions. One of those is, was there direct trauma or not? That gives me a big idea of what I'm going with. A lot of times when there's no direct trauma, I'm usually looking at some type of compensation, some biomechanical deficiency in there. Direct trauma, yeah, they got hit in a certain area. I expect it to be hurt there. I don't tend to treat a lot of direct trauma acute cases just because usually the tissue is too damaged at that point. I tend to spend more time in the chronic overuse type of thing. And then the other question you want to ask yourself is the presentation and the symptom that you're feeling, is it the cause or is it the effect? And so many people end up treating the effect and they don't get to the root cause of the problem. Another thing I want to address is the one thing fallacy. So what is this? As practitioners, we really want to default to that the only problem is just a soft tissue related component. It might just be like a tight muscle, or in this case, lymphatic whatever isn't draining properly, and that's causing this whole cascade of problems, injury presentations, and that your one magic thing is going to solve every single complex musculoskeletal problem out there. I had this story, it's going on like 6 months ago. I put up this post about, I think it was the lumbar multifidus and the role of it in stability and putting more wear and tear on the discs and the joints in the back, leading to disc herniation, sciatica-like presentations. And one of these self-proclaimed lymphatic guru technique persons decided it was a good time to let me know what exactly was wrong and that I was missing it. They said something like the thymus gland was blocked and the lymph isn't draining correctly, and if you just release that or you fix that or whatever the fuck they do, that it's going to magically fix all the problems. I'm like, get the fuck out of here with this crazy shit. First off, don't comment on my stuff when you don't have an idea what you're talking about. But this idea that like this gland is blocked, it's going to cause all this shit. Maybe, but That's not going to like just miraculously have someone get like an 8 or 9 out of 10 in their back pain and come into your office because their thymus gland is blocked. They're coming in because their joints and their discs and their muscles and their tendons and their ligaments and their nerves are all fucked up and jammed up with scar tissue and having a lot of problems. Sure, the lymphatic part might contribute to that, but it's not like this magic one fix all type of thing. And if you want to do lymphatic based drainage treatments, that's totally fine, but pick a lane and stay in it. Like, just only do those type of treatments. I think they could do really well for post-surgical people, maybe for people going through chemotherapy. Sure, that's awesome, but stay the fuck out of the lane of trying to solve injuries with your lymphatic based treatments, because it's not there. Like, just focus on your lane, have a focus of where you want to be, and don't cross over, and don't come on my page and start writing shit like that the thymus gland is blocked and it's causing all this crippling back pain. Get the fuck out of here. Sorry, I'm swearing a lot, but that's okay. I'm a little fired up. Next one is just shiny object syndrome. We all get this as practitioners. We want to get more and more tools in our tool belt. We'll go take a class or a seminar, and then we'll come back and we'll be like, oh, this is the most amazing thing we've ever seen. I do it for 2 weeks and then it doesn't work. Then you're on to the next seminar, the next treatment. You're just continuing to stack up more and more and more stuff. You never know what works. You're spending an hour and a half with the client doing a bunch of treatment, not really knowing what works, but you're like, shit, I'm going to do it all and just throw the kitchen sink at them, and it's not going to fix anything. Instead of focusing on like 10 things to do, focus on the 1 or 2 things that are going to make the biggest change, the biggest results, get really good at those, and continue to do those over and over again. Some questions you got to ask yourself, and this is the most important question. Do I need more tools in my tool belt, or do I need to sharpen the ones I already have? I definitely think it's the latter. Thinking that you have all these tools, but then you're not good at any of them. You're really a jack of all trades, master of none. Then you really don't know what works. Then you're taking all these different seminars. You're like, oh, I got this new awesome thing I'm going to institute. And you do it on everybody for 2 weeks, then you go right back to where you were, and you're still not getting to the critical part of what's going on because you're not critically thinking, you're not slowing down, you're not asking the right questions, you don't know why this problem is happening, you're just getting in there and you're stuck treating so much of the effect and not the actual cause. What's the verdict on lymphatic drainage being a treatment? It's not. It does not meet the criteria that I talked about earlier. That might make you mad, that might make you butthurt. That's okay. Just challenging your paradigm and your views. Don't get stuck in what I call confirmation bias, where you just think this one thing is going to fix everything. You put blinders on. You don't realize that there's more there. The human body is very complex. It's a multi-factor problem. Isn't going to be solved just by one thing. It's a combination of that. So it's not a treatment. A treatment is not reducing those pathologies. But I will give it this. It definitely can be maintenance. Like, maintenance is important. I really look at this as like the dentist's office. I learn a lot just from watching dental practices. You have the dentist and then you have the hygienist. The hygienist does important work. Yeah, they clean your teeth. They make sure things are functioning good. And I think that's what lymphatic drainage is. I think that's what cupping could be. I think that's what stretching could be. I think that's what postural programs can be. Really important. But when you got a really bad cavity or you need a root canal, none of that stuff is going to fix that problem. You're going to go to the dentist. You're going to get the tooth drilled out. You're going to get it fixed with a unique set of skills because they know exactly what the problem is. They know where to go, and they know how to fix it as quick as possible. So no, lymphatic draining is not a treatment, but it is maintenance, and maintenance is really important. But the key is, and what I want you to be is, I want you to be the dentist in your practice. I don't want you to be the hygienist. Everyone else out there is a hygienist, and they kind of get paid the same. They get paid for their time. They don't get paid off results, and it's pretty much the same. Now, the dentist can go to a whole different level. If they can take away your awful pain, think about this with an injury, they can take that away and you can fix it as quick as possible. You are way more valuable and way more recession-proof because you are providing a solution. So be the dentist. That's all I got on the video. If I triggered you, I don't know what to tell you. Sorry, don't watch my stuff. If you got any questions you want me to cover, send them in. Always happy to do these and answer and give a different perspective and try to be a little more factual based about it and take my emotions outside of it and really focus on the client that's in front of me and giving them the correct treatment that they need each and every time so we get results. Go grab my free training, just revamp that where we really dive in, figuring out a common pathology and neck pain presentation of the disc that causes a lot of problems and how to manage it, how to treat it, how to recognize it, and get on the path to becoming that solutions provider. Also, we just got approved for CEU courses on our online training platforms. If you're interested in that, reach out wherever you're consuming this. We'll let you know what we have available. And lastly, just go out there and be great today, this week, this month, this year. It's the only thing that truly pays. I appreciate you guys watching. I'll see you on the next one. Bye.